over the last few years, but definitely a lot of the antiretroviral treatments has been donor funded through PEPFAR directly from the US. And this is not just in Kenya. Uganda and Tanzania are facing the same crisis. We are just about to witness something serious, Bwana Kamanya, don't you think? With this, even if temporary, freeze.
Well, Fred, yeah, very good morning to our viewers. Allow me to send out a quick reminder to all the road users, avoid incidences and accidents. Well, I think the issue of donor funding, even beyond the HIV pandemic, I think has been overly abused, in a manner of speaking, by largely the African continent. Because you realize that our economy has become a donor-dependent system that cuts across health system, education system, social interventions. We've seen community empowerment programs running years on end, just purely based on donor funding. And I think that, in a manner, rendered our economy somehow lax on developing our own homegrown solutions, as Kathy alludes to. Hence the shock now when the donor says, I think from now henceforth, I'll have to revise my operating system, my mechanism on how I've been dispensing my resources. Further, we have developed a sense of entitlement. That's why you hear people saying, no, USAID should not do that. The Americans should not just flip the coin on day one and change how we have been running things. That's a false sense of entitlement. Unfortunately, it affects lives. As you say, the antiretrovirals have largely been, just in Africa, all the way from South Africa to the West Africa, have been supplied and sustained by the donor funding. You have the USAID, you have PEPFAR, you have AMPATH, and many other sub-agencies. And the lives that will be affected, unfortunately, are being, in my opinion, let down by our own health systems. It is further unfortunate that we do not have a buffer, that upon withdrawal of donor funding, just 1 week, jobs are lost. We should have had a buffer system whereby we can sustain our system 6 months, 1 year, should such things happen. Because America reserves the right to help whoever they want to. Further, as Arnold says, I mean, why does America continue supporting in billions of dollars, supporting African countries? What is the motive? What is the end goal? Are they just offering the services that we see? Or is there more? So all these questions come. But I agree with my panelists that this is a wake-up call. It is upon us to revise our local health systems. Because 60 years into independence, 60 years into liberation, we should be able to have at least our homegrown system that we are able to fund for the longest time possible. And any donor funding should just be complementary. But this shows that if Africa is affected this way, we look now into other countries, then you must ask the question, what is the impact of America on global issues? So it's something to contend with, and it's unfortunate, but I think as Africans, starting with now the East African community and then the AU, these are some of the issues we need to start addressing at the policy level.
Yeah. And this comes at a time